Coronavirus cases in Colorado continue to have a very concerning upward trend. And we know you have a lot of questions about the virus. That's why every week on CBSN Denver, we get those questions answered. So joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, are you worried that this rise in cases could mean we exceed our hospital capacity?
I think right now everybody has a level of concern here in Colorado about what may wind up happening in the weeks and months to come. But I know that there's a lot of preparation in place. I think it's really important, though, too, to take a look at what's going on around the country at this point in time. You look in places like Wisconsin, you look at Kansas City. They have hospitals that are so overloaded that ambulances are being turned away. El Paso, Texas is now on a mandatory 2-week stay-at-home order, and everyone who is developing COVID is now being sent to hospitals outside of that area. Hawaii is even considering sending newly ill COVID patients to the mainland for treatment. And probably most disturbing is what's going on in our neighborhood state, Utah. The Utah Hospital Association has just submitted a plan to their government in order to figure out what to do with the overload that they have. They are considering rationing care. In other words, if you get COVID, there is going to be a protocol to follow over who gets treatment and who does not. Certainly a scary thought in this day and age, but that is the reality of what's going on. Fortunately, we're not at that point, and hopefully we'll never reach that point here in Colorado. I think that we learned a lot with what happened in the spring. I think that we are better prepared. We are also well supplied at this point in time. We have stockpiled supplies, and right now current usage of things like ICUs and ventilators are at a low level, but that does not mean certainly that we can get complacent. I think the worries are severalfold. Number one, if we do have a need for a lot of ventilators, it's not like you can just take somebody and teach them how to run a ventilator. Staffing is going to be a big issue, number one. Number two is if there is a flu outbreak, it has the potential to overload our hospital system. And number three, certainly if COVID winds up taking off, we do have the potential for being overloaded like many of these other states, which is why we need to continue to listen and pay attention to the guidelines that we've been given by our state. And I don't think that it's unreasonable to wear a mask. And I don't think it's unreasonable to continue with social distancing and so on and so forth. These are things that will keep us from rationing care.
And going off that, we know the governor said small gatherings are helping lead this rise in cases. So the city of Denver has limited in-person gatherings to 5 people. Meanwhile, the state says no more than 10 people, and they can't be from more than 2 households. So, Dr. Dave, why is it so important to be limiting contact right now? I know you kind of touched on it, but tell us a little bit more about that.
Well, you know, we've known for a long time that large gatherings do have the potential to produce many cases. And so we're learning more and more, though, that it is the smaller gatherings that are actually driving the increase in cases that we are having. And that means that even families that are getting together, friends who are getting together, workplaces, there are issues where all of these things will contribute to the rise in cases. Now, let's say I come in contact with you. I now have not just come in contact with you, but also everyone you have come in contact with over the past 14 days, as well as everyone that those people have come in contact with over the past 14 days. So, you know, you're thinking that you're seeing someone you know and you can trust, and it's a very small bubble, but actually there is a big extension. And so the risk of even a small interaction with somebody actually has a lot of potential for involving many other people and therefore spread.
Yeah, it's interesting. I don't think a lot of people think of it quite in that way. This one's been causing a lot of conversation. A federal judge ruled 2 Colorado churches don't have to limit how many people come in. They don't have to wear masks. The state is appealing that ruling. So are you concerned this decision could lead to an outbreak?
Yeah, it's interesting because you take a look at this particular case, and it essentially is claimed that there is discrimination, there is a loss of the constitutional right to religious freedom. And, this is a legal issue at this point in time. But from a public health standpoint, it's a problem. Because anytime you have a situation where you don't have a group of large people who are distancing, you are not masking, and you do have a large number of people, the potential for outbreak within that particular community, as well as the community in general, becomes higher. We've seen that in religious and church settings throughout the country. So yes, it is a big concern. What's interesting is that after this ruling came out, that there were several other church leaders around the state who came out and said, we actually are in favor of following the state's guidelines. We think that we can do our form of worship within those guidelines because even being limited, it is for the greater good. And, I want to emphasize this point. I go to church every Sunday. And so this is important to me. But you know how I do church? I do church at home. It is on a computer. It is a virtual service. And so for me, yeah, it is a matter of giving up the ability to be with others and worship with others. But to me and to those that I know, it is a matter of putting the greater good ahead of your own personal good.
Yeah, I've seen a lot of churches come up with different ways to make sure some people can be in person, some still virtual, in a safe manner. Finally, a new study finds mouthwash could help prevent the spread of coronavirus. Tell us a little bit more about what researchers have discovered with this.
This was an interesting study. It came out of Penn State University and basically says that mouthwashes can wind up killing coronavirus. And so therefore, maybe it would be useful in the general community in terms of preventing you from getting coronavirus or spreading coronavirus. Sounds great. But one of the problems we have with this particular study is that, number one, it was done in test tubes. It was not conducted in human beings. So we don't know whether it's practical from that standpoint. Number two, it actually did not test COVID-19. Now, COVID-19 is a coronavirus. There are many coronaviruses, and what was tested were coronavirus disease particles that actually cause the common cold. So it did not have very much to do with COVID-19. But let's say it did. What do you need to do with mouthwash? Does this mean that you should be using mouthwash once a day? We don't know how long it works if it does wind up taking care of any particles of disease that are in your mouth. You have to use it once a day, 10 times a day, 20 times a day. And we also have to remember that mouthwash just works in the oral cavities. It doesn't work through the rest of your body. So, it certainly is not a situation where you're going to wind up infusing or injecting mouthwash into people. So, even though mouthwash may be good from an oral hygiene standpoint, masking, social distancing, and everything else is still important. So if you wish to use mouthwash, please do, but do not count on it as something that is going to protect you or protect others from COVID-19.
So we don't need to rush to the store and stock up on all the mouthwash.
No, it'd be a mouthwash shortage if you listen to this study.
Thanks so much, Dr. Dave, as always, for joining us today. And we'll be back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.